If you are sunburned right now, you probably can't wait for the pain to go away. Generally, we know in a couple of days it'll feel a lot better, but your burn may end up peeling, or like me, you might look forward to the nice bronze colour that can come with it. But did you know there's a limit to how fast your body can heal itself from sunburn? And on this video, I'm going to give you my top 10 tips that will push that limit so you're healed as fast as possible. Tip number 2, it's a bit out there, but I've used it and it definitely works. My name is Sarah Jeffries. I'm a registered nurse here in Los Angeles, California, with a background in emergency room nursing and education. So let's start off with number 10. Have a cool bath or shower. The American Academy of Dermatology recommends this as it soothes your skin, but also when you get out of the bath or shower, if you leave a little water on your skin, just gently pat it dry, then put a moisturizer on straight away. This trick helps trap in that excess water on the skin, which helps with the healing. Tip number 9. I say this so much in a lot of my health tip videos, but resting and sleeping when you can is the absolute best thing for healing. Not getting enough sleep in terms of sunburn disrupts your body's production of protective cytokines. These cytokines are a form of protein in your body, and your body makes it during sleep to help your body manage inflammation. So ultimately, a disruption in sleep can negatively affect your body's ability to heal itself. Tip number 8. This might sound obvious and probably the last thing you want to do, but avoid additional sun exposure. Exposing a sunburn to more UV rays can further damage your skin. So if you do go out, cover your sunburn with clothing and wear a high factor sunscreen. Tip number 7, apply aloe vera. Aloe vera is a moisturizer and it contains a substance called aloe, and that reduces inflammation. It also moisturizes your skin and can instantly ease the pain and also prevents peeling. Tip number 6, avoid using tobacco. Smoking or using other forms of tobacco can impair your body's natural healing process. Nicotine narrows the small blood vessels that normally bring you oxygen, nutrients, and healing factors to your injured area. So just don't do it. Tip number 5, apply your hydrocortisone cream. Hydrocortisone creams are a mild topical steroid cream. They're used to treat swelling, irritation, and itchiness. The Mayo Clinic recommends applying hydrocortisone creams such as cortisone to severe burns to manage the swelling and pain. You can get this stuff from your local pharmacy. Tip number 4, stay hydrated. Sunburn draws moisture away from your skin, so drinking plenty of fluids and electrolytes can help rehydrate your skin. Sounds like a no-brainer, but I'm one of the people who do not drink enough. Tip number 3, soon after you notice or feel your sunburn, try applying a cold compress to your skin. This is going to help draw excess heat away from your skin and also reduces inflammation, and it just feels good to have that hurt sore skin with a nice cold compress on it. So like a nice damp towel, and yeah, it feels good. Tip number 2, now this tip is a bit out there, but it's something that I've tried and tested and I swear by it, and it's an oatmeal bath. Yes, that's right, oatmeal. So get yourself in that porridge. You can make an oatmeal bath by mixing a few tablespoons of baking soda and about a cup of oats into a cool tepid bath, and it helps by soothing and moisturizing the skin, and again reduces inflammation. So it's also good when you don't have sunburn to target those dry patchy areas once in a while. My mum used to do it. She'd cut the foot out of an old clean pair of tights or pantyhose, as you call them over here, and fill it with porridge and then just throw it in the bath and would squeeze it, and the porridge would get the slimy white oat milk out, and it just smells good and it's so good for your skin. Let me know if you've tried that before. Also, before I tell you what number 1 is, I'd love to know, are there any methods you use to treat sunburn that I've missed off? Also, I just have to say, this is not a replacement for medical advice. I have to mention, if you have severe sunburn that's blistering or causing you to feel sick and dizzy, or actually cold, you may be suffering from sunstroke. It's a good idea to visit a doctor to see if you need additional medical treatment. So tip number 1, obviously it's a medication. I'm an ER nurse, so this is the first thing I do personally. If you ever end up in my triage room with sunburn, it's one of the first things I'm going to ask you. So I recommend taking an over-the-counter pain reliever like acetaminophen, paracetamol for English in the back, or ibuprofen to help with the discomfort. But don't forget, consult the pharmacist or your doctor if you've never taken these medications before. Click here if you want to know how to get the best night's sleep ever, which also helps with your sunburn healing.